the well-being of Jamaica's youth is of paramount importance, and non-communicable diseases, NCDs, pose a significant public health challenge, with 1 in 3 Jamaicans having hypertension and 1 in 8 suffering from diabetes. And whereas in 2017, over 30,000 children aged 10 to 19 were found to be hypertensive, and the rising levels of obesity affecting 20% of boys and 26.4% of girls aged 13 to 17 highlight the need for urgent action. And whereas the World Health Organization recognizes school food policies as a proven intervention to reduce NCD risk by fostering healthy eating habits in children, and whereas since 2021, the Jamaica Youth Advocacy Network and other youth organizations have advocated for the finalization and implementation of the school nutrition policy to create a healthier food environment for students, with a green paper presented in May 2022, followed by stakeholder consultations in September 2022. And whereas more than 3/4 of students in Jamaica rely on school canteens or vendors for their meals, exposing them to unhealthy food options due to the absence of formal regulations. And whereas there have been no significant updates or progress on the SNP since the last consultations in September 2022, leaving our youth vulnerable to unhealthy food environments that contribute to rising levels of obesity and other diet-related conditions. And whereas the failure to implement these critical health interventions stands to cost the Jamaican economy an estimated $77 billion between 2017 and 2032 due to the impact of NCDs. And whereas there is a pressing need for comprehensive regulations, including the ban on unhealthy foods and beverages, the development of school food gardens, and the incorporation of physical activity and nutrition education into the curriculum as proposed in the SNP. Be it resolved that this Honorable House calls upon the Ministry of Education and Youth and the Ministry of Health and Wellness to expedite the finalization and implementation of the school nutrition policy by the end of the current academic year, with execution beginning before the start of the 2025 to 2026 school year. Be it further resolved that the government establishes clear timelines for the regulation of unhealthy food and beverage sales and marketing within school environments, as well as the provision of healthy, locally sourced food options to support both student health and local agriculture. And be it further resolved that this Honorable Senate mandates the inclusion of youth in the monitoring and evaluation process of the school nutrition policy to ensure transparency and accountability in its implementation, safeguarding the health and future of Jamaica's children.